Excited to introduce our speaker for today. So today we have with us Patricia Blinn. So Trish, I'm not sure if many of you have been present at her talks before. She has presented with us in the past and has given very informative conversations and presentations. So we're very excited to have her back on board with us. So Trish is an occupational therapist at the Cancer Rehab and Survivorship Program at the Princess Margaret Cancer Center. She received her Master's of Occupational Therapy from the University of Toronto, Bachelor of Kinesiology from the University of Calgary, and Bachelor of Arts in Psychology from the University of British Columbia. In her role at Princess Margaret, she supports her clients' recovery in a variety of domains, including physical rehabilitation, fatigue management, exercise counseling, psychosocial support, and return to work counseling. She is passionate about cancer rehabilitation, and through her clinical practice, lectures, and patient education, her goal is to maximize function and quality of life for anyone who has been impacted by cancer. So with no further ado, Trish, I will pass the stage over to you.
Thanks so much, Vanitha, for the lovely introduction, as usual. And thank you so much to all of you for being here for my talk on cancer, exercise, and mental health. It's a real pleasure to be here to talk to you today about a topic that's really, really close to my heart. I'm very happy to be discussing this with you for many reasons. For starters, when I first started out supporting cancer exercise programs about 9 years ago, I was truly inspired by the positive impact that exercise had on the mental health and well-being of the amazing participants that I worked with. Seeing this incredible physical and psychological transformation firsthand is actually a part of what drew me to a career in rehabilitation to begin with. I'm really lucky to be working now in a program that really, really values exercise, not only as a way to become stronger, but on a more holistic level of well-being as well. I also want to be fully transparent that this topic is really important to me on a personal level too. Exercise has had an enormous impact on my own mental health, and I have seen it greatly benefit the mental health of my friends and family as well. Again, part of what drew me into becoming a healthcare professional was a desire to share these benefits to others and to make exercise safe, normalized, and more accessible to those that need it the most. Exercise is a tremendously effective yet underutilized tool when it comes to cancer and mental health recovery. And now, with the pandemic having caused so many disruptions on our well-being, this is an even more important topic than ever. In this talk, I hope to not only give you a taste of why exercise can be so beneficial for well-being, but I also want to equip you with some tools and tips to enable you to use exercise to improve your own well-being if you choose. So here's a bit of a map so you know the direction that we're going in today. I'm going to start out talking about the research in cancer, exercise, and mental health and what it has to tell us, and then talk about what specific guidelines are out there. I'm going to talk about theories as to why exercise improves mental health, and also get into why exercise is important for you, and that's you personally, not you generally. I also want to talk about community supports that are available to support you in your exercise, and then some other resources and strategies. And of course, before I get started, it's always important to have a disclaimer. So the material in this presentation is intended for informational purposes only. It certainly does not replace advice from your doctor or your healthcare professional. It's definitely not intended to be a one-size-fits-all formula. So please do not use this information as a diagnosis or treatment. Ask your healthcare provider for advice about specific medical conditions. Another important thing to get out of the way from the beginning is a question I get all too often, but that's, what is an occupational therapist anyways? What am I? So OTs work in a variety of different settings, and the role can look quite different depending on what the practice context is. However, there is one common thread that unites us all together, and that's this focus on occupation. And occupation to us means really any activity that's important to you. So for example, that could be a productive activity, something like your job or going to school. It could be a self-care activity like taking a bath, or even a leisure activity like playing tennis or playing with your grandchild. Occupational therapists have training in both physical and mental health, and they collaborate with their clients to enable them to get back to the activities that mean the most to them. And quite often, this is following illness or an injury. I personally believe that regular exercise can be a very powerful tool for OTs to use to support their clients in getting back to the activities that they love. And hopefully this presentation will help you to understand a little bit about why. And that brings us to our first topic. What is the evidence behind cancer exercise and mental health? Before we dive right in, I also do want to give a quick shout out to the amazing researchers who are making really great strides in the field of cancer exercise and mental health. This slide is by no means an exhaustive list, but these are some very impressive individuals that I'd like to highlight. I am personally more so on the patient care side of things, but I'm not quite as involved in the research. But without the research, we would not be able to objectively show how beneficial exercise can be when it comes to cancer exercise and mental health. This research really helps to legitimize cancer exercise as a tool for recovery. It helps to get exercise into hospitals, fund programs, change policies, and in my personal opinion, change thousands of lives. If you're interested in this type of research, I highly recommend you take a look into these names and you can learn a little bit more. So, what does this research tell us? On the one hand, it has been found that following a cancer diagnosis, an individual is more susceptible to anxiety, depression, and issues around body image. On the other hand, it has been shown exercise has been shown to counteract many of these issues and more. It's associated with positive outcomes for health and well-being. Specifically in cancer, exercise has been shown to improve sleep quality, sexual functioning, quality of life, mood and happiness, body image, self-esteem, perception of sexual attractiveness, post-traumatic growth, perception of social support, and even feelings of connectedness. At the same time, exercise has been shown to reduce depression, anxiety, stress, tension, and emotional irritability. The evidence is actually so strong that it's changing policy on a national scale. So for example, in 2018, the Clinical Oncology Society of Australia came out with the following recommendations. Exercise should be embedded as part of standard practice in cancer care and viewed as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. All members of the multidisciplinary cancer team should promote physical activity and help their patients adhere to exercise guidelines. Best practice cancer care should include referral to an accredited exercise physiologist and or physiotherapist with experience in cancer care. In fact, Dr. Prue Cormie, the chair of Clinical Oncology Association of Australia, went so far as to say, if we could turn the benefits of exercise into a pill, it would be demanded by patients, prescribed by every cancer specialist, and subsidized by the government. It would be seen as a major breakthrough in cancer treatment. A little closer to home, the American College of Sports Medicine has specific guidelines for cancer exercise. These guidelines are based on strong evidence and provide specific recommendations for the type of exercise, the quantity and frequency to reduce cancer-related fatigue, anxiety, and depression, as well as to improve physical function and health-related quality of life. This infographic on your screen is kind of hard to read, but you can download the whole thing for free at acsm.org, and this is only showing you a small section of the infographic. A lot of people wonder what exactly, oh sorry, I'm jumping ahead. Specifically in the guidelines, I do want to highlight that to improve depression and anxiety, the ACSM recommends 30 to 60 minutes of moderate to vigorous physical activity 3 days a week, and to do either cardio only or a mixture of cardio and resistance training. There's not enough evidence to show that resistance training on its own can improve specifically depression and anxiety, but there's certainly a lot of evidence to show that resistance training improves a lot of other domains of quality of life. A lot of people wonder, what exactly does moderate intensity mean when it comes to exercise? And that's actually quite individualized. So what's moderate intensity for you or me might be different than what's moderate intensity for your child or for your neighbor. The talk test can be a really good guide. So this means that while you're exercising, you should still be able to more or less maintain a conversation, but you wouldn't necessarily be able to sing if you tried. And again, a reminder that all these are guidelines. They're certainly not rules. Even a tiny amount of exercise can be helpful, and guidelines should really be adapted to your individual situation, your own capabilities and goals. So far I've been talking about research on exercise and cancer specifically, but I'm going to touch a bit on the research for exercise and depression in the population as a whole. So exercise has been shown in some circumstances to be an impactful treatment for mild to moderate depression. The research backing this is level 1. So this means it's been demonstrated through randomized control trials, which are considered the gold standard of research, and it has the support of clinical experts. Exercise can be as effective as medication or psychotherapy. And now, I'm certainly not saying that medication doesn't have its place. Every circumstance is different, and as an OT, medication is way out of my scope. But what the research does tell us is that exercise is a powerful tool that should not be overlooked when it comes to managing mental health. Exercise can also offer some benefits when you compare it to other lines of treatment. For example, it tends to be lower risk and have less side effects than many medications. It typically has a wait time that's less than psychotherapy. And additionally, given that there's many types of exercise that can be done at no cost, it can be more accessible from a cost perspective. However, if it is within your means to do both exercise and have psychotherapy, for many people, psychotherapy can be an extremely valuable treatment as well. One big challenge when it comes to exercise, however, is that motivation piece. Depression can unfortunately create a negative feedback loop. Often when we're feeling depressed, this causes us to withdraw from physical activity. And that withdrawal can in turn make our depression worse, and the cycle, it continues. It can be difficult to break this cycle, and this is why I'm hoping to share some tools with you later on in the presentation to help you do just that, to intervene in that cycle. So next I'm going to transition to the why. Why does exercise improve mental health? This is a really complex question, and there really is no right answer, but I do want to highlight a few theories. The first one being biological. Exercise actually impacts the same neurotransmitters that many antidepressants do. So these are the feel-good neurotransmitters or chemicals in your brain like dopamine and serotonin. In high intensity exercise, endorphins are released, also known as a runner's high, which can cause feelings of euphoria. However, it's actually the low to moderate exercise sustained over a long period of time that yields the biggest benefits in terms of mental health in the long term. One really fascinating benefit of exercise is that exercise causes the brain to release something that will essentially make the brain bigger. This molecule is called the brain-derived neurotrophic factor, or BDNF for short. And it's the key to creating plastic changes to learning and memory in the brain. So when you exercise, you're literally creating new brain cells. And not only that, but you're stimulating these cells to create connections amongst your other brain cells. I find this factor to be an especially important consideration in cancer, when brain fog is so common and can definitely be a contributor to low mood. It probably doesn't come as a surprise that improved brain function tends to make us feel better, and exercise triggers biological functions that can facilitate this. The region in the brain that helps us regulate mood and is also heavily involved in memory is called the hippocampus. Research has found that this area of the brain tends to actually be smaller in people who are experiencing depression. Interestingly, through various studies, and this includes neuroimaging, it's been shown that exercise actually helps to stimulate cell growth in this area specifically, and thus can improve function and neural connections and even depression. The next category is social. Exercise can be an opportunity to engage with others, create new social connections, and strengthen current social ties. Exercise groups can create a sense of community and belonging. Of course, this becomes a bit more difficult in the middle of a pandemic, but there's still many ways in which exercise can help us connect, even if over the past year it might have been a bit more with members of our own household or through virtual classes. Later on, I'm going to be talking about a tool that can enhance the social aspect of exercise, even during the times that we're not able to meet in person. Next is psychological. One of the most distressing aspects of cancer that my clients tell me is that it feels like their sense of control has just been yanked out of their hands. Especially for those of us that are very oriented towards solving or fixing problems, a cancer diagnosis, the tests, surgeries, and treatments, and side effects that can ensue can leave someone with a sense of powerlessness. Exercise is a tangible tool that can be within our control that can help to improve our situation. This in turn gives you what psychologists call an internal locus of control, meaning a higher belief that you have control over the outcomes in your life. This is very empowering and associated with better health outcomes. Another aspect that exercise helps with is that people who exercise tend to have higher self-esteem. It improves what psychologists call self-efficacy, which is the confidence and the ability to exert control over your own motivation, behavior, and social environment. It is the belief that you can be successful in your tasks and your actions. Lastly is physical, and often our minds jump to physical when we first think about why exercise is beneficial. As you know, adverse treatment side effects can cause people with cancer to be more likely to have body image issues. Regular exercise tends to help people to feel more confident and accepting of their physical bodies. Also important in the physical domain is that exercise can help to prevent cancer recurrence, as well as help to prevent other comorbidities like heart attacks or strokes. Feeling healthier overall and reducing the likelihood of yet another acute or chronic illness will certainly have an impact on our mood and our quality of life. When you take a step back and you think of all of these different domains combined, it's really not surprising that we tend to feel better if we exercise regularly. But despite the evidence, here's the real punchline. The fact is that 57 to 88% of individuals with cancer are not currently exercising. They are inactive. That is an overwhelming proportion of individuals who could potentially be benefiting from physical activity. That's why in a moment, I'm going to transition to talking about tips and supports for increasing your activity if it's the right time and if you choose. At the same time, let me be clear. Even for someone that's otherwise physically healthy, beginning and or maintaining a regular exercise routine can be extremely difficult, let alone for someone who's coping with the side effects of numerous treatments and surgeries post-cancer. If you're having trouble being active, please know that this is normal and you are definitely not alone. This is not a reflection of your resilience or strength, and our society is structured in a way that favors inactivity. And our medical systems, although they are improving, can be far behind when it comes to cancer exercise knowledge and supports. It's totally okay to have a tough day, and it's totally okay to need rest. At the same time, I also know that there's many people following a cancer diagnosis who are ready and willing to increase their physical activity, but they just feel like they need a little bit more support. Now, You probably already knew that physical activity is good for you before I started my presentation. And if we know how good exercise is for us, why aren't we all doing it? That's because some of the most important reasons for you to exercise are the ones that a healthcare professional can't actually tell you. They're the reasons that only you know, and they're specific to your life, your goals, and your circumstances. Research shows that the key to long-term behavior change is not to just be told what to do, but it's actually to have the space to reflect on your own personal reasons for why making the change is important. In a moment, I'm going to show you 4 questions. When I do, I'd like you to take either a screenshot of the questions, maybe use your phone to take a picture, or maybe just write them down quickly. They're short questions. After this talk, you can go through each question and answer them either out loud to yourself, through writing, or maybe you discuss them with a loved one. Everyone's answer is going to be different. Are you ready? Okay, here they are. How could exercise be beneficial for me? And this question isn't asking what are the general benefits of exercise. So for example, improved strength. We're really trying to dig a bit deeper here. How can physical activity be beneficial for you in your life personally? Be specific. So when I ask this question to clients in my clinical practice, often at first they tend to give me broader, more generalized answers, like maybe because they'll feel better. But when I get them to dig a bit deeper, they might give me more detailed, thought out examples. So for example, I've heard, because I want to be able to play with my young grandchildren, and right now I'm just not strong enough, but my grandchildren mean the world to me. Or maybe, I want to exercise because I am terrified of recurrence, and now I know that exercise is something that is within my control that can reduce this risk. I want to do everything I can to make sure I'm around for my children. Or I want to be active because I know that I'm capable of it. I've done it in the past, and when I did, I felt so much better. The next question is, what is getting in the way of your regular exercise? There are many barriers that tend to get in the way. Most frequently, people tend to tell me there's just not enough time. So for example, maybe it's the need for childcare, or many of my clients tell me that they don't exercise because they don't know how and they're worried about hurting themselves or doing it wrong. Explicitly identifying and writing out what these barriers are the first way to overcome them or to come up with solutions. The next question is, how can I increase my exercise? So you are the expert in your own life, in your skills and abilities, and what resources are at your disposal. This is a chance to identify strategies for overcoming the obstacles that you've identified. For example, if childcare is the issue, can somebody watch the kids? Can you maybe involve the kids in the exercise in some way? Or is there even maybe an activity you can do where you can still keep an eye on them? If you've been feeling too tired to exercise, think of the times of day when your energy tends to be the highest. So for example, if you're really a morning bird, can you reorganize your day so that you get your exercise done earlier in the morning? Can you fit exercise functionally into your day? So for example, maybe get off the subway a stop or two early, or park a little further away from the store when you go to get groceries. Think creatively and write down potential solutions. And finally, the last question. What is my next step? Important here, keep this simple and achievable. This way you're much more likely to follow through. This could be as simple as ordering new running shoes, maybe just checking the air pressure of your bike tires, or maybe right now you pull out your phone and you text a friend to see if they're free for a walk this weekend or this evening. If you go through all these questions and you feel you could use more support from a professional, in a couple slides, I'm going to go through some options that might be of interest to you. But first, I do want to highlight another important aspect when it comes to physical activity. So physical activity does not necessarily have to look like running or like lifting weights. It doesn't even have to necessarily be structured. One of the best things we can do for ourselves is to move and change position frequently during the day. For those of you that attended my posture and positioning webinar, this might sound a little bit familiar. And that could even be as simple as taking a break from sitting by standing up. Incorporating small bouts of movement into your day can actually reap more health benefits than exercising for an entire hour, but then otherwise being sedentary or inactive the rest of the day. And now, in the spirit of practicing what I preach, I'm gonna stand up and take a break from sitting. Luckily, I have an adjustable standing desk here at the office. I'm very fortunate to have that. And if it's safe for you, I encourage you to do the same. No one can see you. Go ahead and stand up. Maybe do some stretches, maybe do some marching on the spot. And if standing isn't accessible for you right now, that's okay. Maybe you move your arms through your pain-free range, you move your head back and forth. Whatever it is that you can do that feels right, that gets a little bit more movement into your day-to-day. Bonus of a webinar like this is none of us can see you. So if you want to bust out your favorite dance move, you're also welcome to do that. No judgment here. And I'm going to try to continue the rest of this webinar in standing. We'll see how it goes. So now I want to talk about some more supports in terms of cancer rehab and exercise programs that are in Ontario. And these are the ones that I'm aware of in Ontario. Most of these are in the Toronto area, and I do need to preface that at the time this is being filmed, so right now, June 2021, the waitlist for some of these programs are pretty long because of disruptions from the pandemic. And it's also pretty mixed now, what's offered virtually, what's offered in person, or what's kind of a hybrid model. And I imagine this is going to keep changing in the coming months. So please keep in mind that by the time you're watching this, if it is recorded, things might have changed, but hopefully it's helpful to at least get a taste of what's out there. The first one is Toronto Rehab Outpatient Oncology Program. So this one isn't so much for generalized exercise, but more so appropriate if you're someone that's having a mobility issue or a difficulty carrying out your activities of daily living. So one example would be if you're having shoulder pain or you're having difficulty moving your arm following surgery or radiation and you need rehab. You do need a physician's referral to qualify, and generally you also need to be assessed by a physiatrist at Princess Margaret before you're able to start. When I last touched base with the clinic coordinator, she did say that the waitlist is quite long at the moment, but it is a great program with very skilled therapists. The next one, I imagine you might be aware of, given this is a Wellspring webinar, but very wonderful is the Wellspring exercise program. This one, as far as I know, is currently still being offered virtually. I think there's some whisperings that it might pick up in person kind of later on, more towards the late fall or winter, but stay tuned for that. But the good thing about the new virtual format is that it's accessible, I believe, all throughout Canada, which is wonderful. It's a 12-week program, and the program leaders are very knowledgeable in terms of cancer exercise, and you receive exercises through an app to help you to complete the workouts. The program is open to any cancer type or treatment or stage and just requires your oncologist or GP to fill out a physician's consent form. There's also an exercise program specifically for individuals living with advanced cancer that you can enter after you've completed the initial 12-week program. And in addition, I hope you've all heard that there's really, really great drop-in fitness classes at Wellspring currently being offered virtually. And this includes yoga and also Tai Chi. The next program I'll talk about is the CARE program. So this is a wellness program that's offered through the Cancer Rehab and Survivorship program where I'm currently working. I don't lead it, it's led by the kinesiologist here, but I do sometimes refer to it along with all of these other programs that are up on here. Currently, it's only available to Princess Margaret patients. Essentially, a kinesiologist meets with you to help you to build an individualized exercise program and continues to connect with you regularly. It's been virtual for most of the pandemic, but it is starting to open up to in-person as well, especially for your first meeting with the kinesiologist. And I think it's also available as a hybrid model, so some in-person, some virtual. It's 8 weeks, and it does involve broader education modules along with the exercise, which is why it's a wellness program, not just exercise. And the topics for this include fatigue management, brain fog, managing difficult emotions, nutrition, mindfulness, and more. There's also a special group for advanced cancers and a new group that's in the works for bone marrow transplant, but not quite out yet. And just throwing back to the Wellspring program, I did learn that there's also some short education modules tied to that one as well. I'd imagine likely with similar topics. The next one is the Rumsey Health Program. The health program stands for Health, Exercise, Active Living, and Therapeutic Lifestyle Program. It's for women with breast cancer, and it takes place at the Toronto Rehab Rumsey location. So just another throwback, the initial Toronto Rehab program I was speaking about is at the University Avenue location, so different hospital. For this one, I believe it's been paused for the pandemic, but I've heard whisperings it's starting to come back around now, so it's one to look out for. Full transparency, I don't know as much about this program simply because I've never worked or been involved in that location, but I did hear that it was about 6 months long, so a little bit longer term. Next one I want to mention is Gilda's Club. So Gilda's Club has virtual drop-in yoga, Zumba, and stretch classes, last I checked. And so far, by the way, all of these first options that I've mentioned are of no cost at all to the participant. The last one on this slide that I want to mention does tend to have a fee associated with it, but it is important to mention because there may be shorter wait times, and you might also find someone that's able to work with you over the longer term or on a more frequent basis. But community physiotherapists can be helpful for helping to regain strength and mobility following cancer treatment, and also to build a home exercise program that's individually catered towards you and your goals. I would recommend, if possible, looking for someone with cancer-related experience. And sometimes community physios are also covered under your insurance, so it could be a good thing to check out. If you're someone that doesn't really want to take part in a formal program or any one-on-one therapy, or maybe you're someone that's already done those things and is looking for the next step, you still want a bit more support, there are some things that are available for you in terms of guidance. These resources can help you to learn more about exercising safely, setting fitness goals, and maintaining health behaviors. So the first one that I have on this slide is the ACSM guidelines. So I did mention these earlier, and this is kind of more of your quick and user-friendly resource that can be found simply by Googling ACSM Cancer Exercise Guidelines or going to acsm.com. There's also the Thrive Exercise Manual. So this manual is put together by Dr. Kulos Reed and Dr. Loren Capozzi, along with many other collaborators from the Health and Wellness Lab at the University of Calgary. It's a 90-page manual, and you can download it for free at thrivehealthservices.com. It includes information on understanding risk factors, guidelines for getting more active and staying active, eating well after a cancer diagnosis, and much more. The last one I have up here is kidney cancer specific. So it's also put together by multiple and very impressive collaborators, including Dr. Linda Trin at the University of Toronto and Dr. Jennifer Jones at Princess Margaret. It's 113 pages and has resources on the benefits of exercise for kidney cancer, how to get active, signs to watch out for, how to make exercise fun, overcoming barriers, and much more. This can be downloaded for free at kidneycancercanada.ca. Another question that I get quite often is, what is the best exercise that I can be doing? And my answer is really, provided that you can be doing it safely, of course. The best exercise is the one that you're actually gonna do. So a lot of people view exercise as needing to either go to a gym a bit harder these days, or lifting weights, or being on the treadmill, or running. But this certainly doesn't have to be the case. You can get exercise playing with your grandchildren, or flying on a kite, or working on a woodworking project, for example. There's such a variety of things out there to get moving, from swimming, cycling, playing tennis, or sports. A great trick is to incorporate it with things that you do enjoy. So for example, if you love nature, if you love bird watching, that's a great way to get exercise by going walking outside in nature. If you are someone that enjoys time with family or friends, incorporating them by exploring a new neighborhood together or trying a virtual class together even can be a great way to get exercise in. Dancing is also a great way to exercise, and that can be a formal dance class, but it can also be informal. It can be dancing around your kitchen, listening to a good tune, or busting out some moves while you're watching this webinar. And whether you're dancing or not, music can be a great motivator when engaging in exercise. There's some really great research by Matt Stork showing that music can enhance task enjoyment and feelings of pleasure when it comes to exercise. And the best type of music is your music. So studies show that the best music for motivation and increasing exercise is self-selected. So maybe you take some time after this webinar today and you build yourself a fun motivational playlist. So social support, as I mentioned previously, is a really important piece when it comes to engaging in physical activity. It not only helps you to stick with the physical activity, but it can create a sense of belonging, and it can also reduce feelings of depression and anxiety. Teaming up with family and friends is a great strategy for staying active and helping you to stay accountable to your goals. However, it is understandable that in this new world of coronavirus and social distancing, hopefully things are getting better, hopefully, but this strategy can still be more difficult, but you still do have some options. I want to highlight a resource that's available to help you connect with other people with cancer who might have been through similar experiences and who share similar exercise goals. And this is called ActiveMatch. It was started by Dr. Kathy Sabiston out of the University of Toronto. It's a free online service that helps specifically women who have been diagnosed with cancer to find their ideal exercise partner, or at least as close to ideal as possible. Any woman in Canada with a previous cancer diagnosis can sign up, regardless of type or stage. The goal is to have women feeling supported, connected, and encouraged when it comes to exercise participation. To find your match, their matching algorithm actually takes quite a lot into consideration. So for example, your age, your life circumstance, your physical proximity to your potential partner, interest in exercise, the type of cancer, including your severity of symptoms, your exercise history, and of course, very importantly, your personality. Of course, given social distancing, these matches might have not looked quite the same over the last year and a half, but I did email ActiveMatch to get an update on how matches can still provide support and motivate each other for exercise without physically meeting. And they told me there's been lots of really great successful matches that have helped each other maintain exercises. And here's some strategies that they got back to me with. So maybe the matches will exchange numbers so that they can text each other on a regular schedule and offer motivation support. Connecting over the phone to strategize about building more exercise into their day. Maybe planning a walk and talk phone call, so keeping each other company and support it while sticking to a regular walking schedule. Or finding a new physical activity that they can try together but apart. Or maybe sharing tips and strategies that they found helpful in maintaining their physical activity, or signing up for a virtual class or exercise program. Another important piece of staying active is a little bit of planning and organization. So remember, even a small amount can make a big difference. Set a goal that's reasonable for you. For example, if you haven't been active for a while, maybe you don't start with a 10K run, but maybe you plan a 10-minute walk instead. Schedule it into your day and week, whether that's using a physical agenda or calendar, or using the calendar on your phone or your computer, and treat these scheduled exercise times with the same importance that you might treat taking a medication or going to an appointment. Another great way to make physical activity a habit is to pair it with the activities that you're already doing daily. That way you don't even need to carve out extra time. You're simply adding activities to something you'd otherwise be doing. So one example, which we mentioned in the previous slide, was go for a walk while you're talking on the phone. Maybe you stand up and stretch during a work Zoom meeting, if you can have your camera off. Maybe you do calf raises while you brush your teeth, or every time you go to the bathroom today, you decide you're gonna do 5 squats after. I've actually started doing calf raises or lateral leg raises while I'm waiting for the elevator of my apartment. And given I'm on the 22nd floor, that lends for lots of time for some lower extremity work. A little bit awkward when someone catches me, but often I'm on my own, it's all good. Also, as humans, we can really be easily distracted, and it's so easy to lose track of our exercise goals. That's why it can be good to leave visual cues or reminders for yourself. So for example, maybe placing your running shoes or gym clothes in a really visible area, like the floor of your room or maybe your front door. Or you can make a little sign for yourself on your mirror that offers a motivational quote, and you're going to see it every day when you look in the mirror. You can also set timers on your phone to remind you to move, or ask friends and family to remind you. You do have the option to put these reminders on repeat, which I highly recommend. And put these reminders in a place that makes sense for you. So if you're on your phone a lot, that's probably your phone. If you try to avoid your phone, for example, at work, maybe you set it as a reminder in your Outlook calendar so it bleeps at you no matter what. I have a client that told me to remember to do her exercise or to take breaks from sitting. She's going to ask her young kids to remind her. She was like, trust me, they're way more relentless than any timer will be. I'll be on it. And finally, schedule small bouts of movement into your day. As I mentioned before, this can go a lot further than even exercising for an hour, but then spending the rest of the day just sitting. Time is also such a common barrier that comes up when it comes to exercise. And if this is your number one barrier, you are definitely not alone. However, it can also be a catch-22, and I see this all the time working in rehab. Regular exercise can reap really great benefits, such as improved mood and more energy. Often when people are feeling better from becoming a bit more active, they're actually able to engage in more activities that they want and need to do. It may seem like a little bit of a paradox at first, but taking the time to engage in regular exercise at the right dose might actually help you to get more done in your day. So give you more time to do the things that you love and enjoy. And this brings us to my last point, which is also a very important one, and I find tends to be excluded when we're talking about exercise maintenance and exercise and mental health. That's the element of self-compassion. If you feel like you've tried everything, but you're still not quite able to make exercise a habit, this might be a little piece of the puzzle that you're missing. So what is self-compassion? It can be defined as compassion turned inwards, and it relates to how we see ourselves in our experiences of seeming failure, inadequacy, or personal suffering. Basically, it's being kind to yourself and saying to yourself that it's okay to have a bad day. It's okay to need rest sometimes, and it's certainly okay to not be hitting that same exercise intensity right now that you could before your diagnosis. As human beings, we have a tendency to beat ourselves up and engage in negative self-talk, especially when we feel that we haven't been able to complete our goals or live up to some sort of self-made standard. These negative thoughts and emotions often leave us not feeling too great. But importantly, they can also create even more barriers from us changing our behavior and getting more active. There's more and more research that's now emerging around the value of self-compassion when trying to build regular exercise into your day. Sometimes our negative thoughts around ourselves are so automatic that we don't even realize that we're having them. Instead, we're internalizing them as if they're the absolute truth about ourselves. One of the first steps may just be becoming aware of these negative self-thoughts. Catch yourself when you're being your own bully, and try to view your thoughts as if you were an observer from the outside. Label these thoughts for exactly what they are. They are thoughts, they are not facts. So for example, if you catch yourself thinking, I'm not good enough, I'm lazy, I'll never be able to do it, this is not a permanent fact about you. This is a temporary thought that you're having in a really tough moment. Remember that everyone, even the most impressive athletes, have these thoughts from time to time. After you've caught yourself, take a pause and reset. Intentionally intervene. Try to speak to yourself the way you would speak to a loved one or a close friend, from a place of kindness and compassion. Most of our negative thoughts towards ourselves, we would never say out loud to a loved one who's going through a similar experience. You can also take a few minutes to write down some positive self-statements that you could say to yourself to help to motivate you for exercise and to help you feel good about the things that you have accomplished. The act of writing these down on a regular basis can actually help to rewire our brains to think more positively. Remember to celebrate your successes, no matter how small they might seem in the moment. There are many free resources online with practical tips and tricks for beginning to hone our ability to be self-compassionate. Selfcompassion.org is one of them, but there are really quite a few resources out there. This one has specifically guided meditations and self-compassion exercises, among other things. And that leads me to my summary today. Thanks for hanging in there with me, everybody. So in conclusion, post-cancer diagnosis exercise improves depression, anxiety, and quality of life, according to the research. It can be just as effective as medication or psychotherapy. It's backed by gold standard evidence as well as clinical experts. It gives you the strength and energy to do what you want to do. It improves well-being through biological, psychological, physical, and social mechanisms. And it's important to take the time to reflect on your own reasons to exercise. Social support and planning help. Try to make it enjoyable. And there are many supports that are out there for you to access if you need. And so importantly is to be kind to yourself. Thank you, everybody, for attending today, and I'm going to open up the floor to questions now.
Thank you so much, Trish, for that presentation. I think you covered a lot of great topics, and I know I saw a comment come in appreciating the metastatic resource you gave, because I think there was a comment that most people find that there aren't many exercise groups that are targeted for that as well. So